Respectable viewers, in today's video, we are discussing the symptoms of skin cancer. The symptoms of skin cancer are the easiest symptoms to detect. This is because cancer of the skin usually manifests itself in abnormal skin growths that are in plain sight. Although these may sometimes look like a simple sore or a pimple, when it fails to heal over time, this can immediately alert the patient that something is wrong. Also, most cancerous skin growths often ooze some fluid, bleed, and crust or scab over, which are more telltale signs that it is more than just a simple growth. These, however, are usually painless, which is why some people still fail to report their case, leading to delayed treatments. If you see new growth on the skin that looks abnormal or does not seem to heal or go away, these should be reported to a doctor. Although many skin growths such as moles are nothing to worry about, it is still best to seek the advice of a medical professional. When growth is cancerous, however, you can usually tell over time as they often change in size or color. The first type of cancer is known as basal cell carcinoma. The typical signs of basal skin cancer are waxy or pearly-looking bumps that can occur anywhere on the body. Basal cells are more common in areas that are frequently exposed to the sun, like the face, arms, and legs. It might also show up on your back or chest as a scar-like spot that can be flesh-colored or brown and can look like liver spots. This is the most common type of skin cancer. It doesn't usually spread very fast and is usually easy to treat. The second type is known as squamous cell carcinoma. It is more dangerous than a basal cell and is characterized by symptoms like red nodules or a scaly lesion that won't heal. This type of skin cancer can show up anywhere on the body, but the face, arms, and legs are where these usually occur. This type does not spread very fast, but the frequency of spreading is slightly higher than that of basal cell carcinoma. It also can easily be treated effectively if it is detected early. Left untreated, this type of skin cancer can go to other parts of the body, making treatments much more difficult. The third type is known as melanoma and is considered to be the rarest and most serious type of skin cancer. Melanomas cause the majority of skin cancer-related deaths. The most effective treatment for melanoma is surgical removal. Melanoma can look like an asymmetrical skin lesion and can have an irregular border. Sometimes the lesion will have multiple colors and can be raised above the skin like a mole. Symptoms of the most dangerous type of skin cancer. The most dangerous type of skin cancer is malignant melanoma. This usually forms on the trunk or on the legs. Although these don't get constantly exposed to the sun, these areas usually get rare but very intense exposure to the sun. Such as when a person spends an excessive amount of time at the beach without applying skin protection products. However, melanomas can also form from an existing mole or freckle, so it is sometimes difficult to identify as well. Keep in mind that when a freckle-like spot on the skin is multicolored and combines shades of brown, black, red, white, and blue, then it could be a melanoma, not a freckle, which is just light to dark brown in color. It is possible to lose the battle against skin cancer when it is a melanoma, although, with many forms, the worst prognosis is that eradicating it will probably leave a lot of scar tissue. This is hard enough when you are an adult, but imagine a child going through the process of identifying and treating skin cancer. It does strike kids, and a service such as a mole mapping can be done on them as well. Even if your child is still young, his moles should be observed regularly for all of the same signs you look for on your own body. Melanomas also have an irregular or uneven border, while a freckle usually has clear-cut borders. Diagnosing skin cancer. Experienced doctors who are trained in diagnosing skin cancer can often recognize their symptoms with one look. To get an idea of the full extent of the disease, however, a complete examination of the entire skin surface will still be needed. Once some symptoms are spotted, a specialist will do a biopsy to determine whether cancer cells are indeed present in the skin cells. This is the surest way to diagnose whether the disease is present or not and to determine its specific type. In a biopsy, a doctor will take cells or tissues from your skin and analyze them under a microscope. There are two types of biopsy, excisional and incisional. Excisional, which obtains a wider margin of tissue around the affected area, is more effective in diagnosing malignant melanoma. An incisional biopsy removes only a small sample of the growth. This is more common and can usually identify other forms of the disease. Thank you for watching.